Hello everyone. My name is Shahid Muhammad. I'm a lead academic and scientist on behalf of the Renal Patient Support Group. And today I wanted to give a brief overview of an art-based research or that has been truly collaborative between the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group for Kids, or KDARS. I'm going to talk to you just a little bit. I'll give you a little bit of understanding about part A of this, or side A of this art focused project. This is a brief synopsis or overview of CKD and evidence-based through art, evidence-based through research and investigation, and this is an academic and research production, and is using art to raise CKD research through awareness. Or side A, this art book will be uh, uh, um, across will highlight our aims to highlight several themes across the long-term condition, that is chronic kidney disease, and in between actually the focuses that are pertinent actually to both pediatrics and young people going through this long-term condition, and also of course adults who will have also have gone through are going through the long-term condition as well. And the main themes really are CKD, or chronic kidney disease lab tests and investigations, biopsy and surgery, diet and nutrition, renal replacement therapy or kidney replacement therapy, psychology and related entities, medication and pharmacy, lifestyle, primary care and GPs, or GP, wellness and well-being, nursing, peer support, COVID-19 and infections, electronic patient records or EPRs, a little bit around the renal patient support group, and the kidney disease and renal support group for kids, or KDARS, some conclusions and some dedications. That is the themes, the themes, and the general contents of this art book. Just quickly though, also obviously on the aims, and basically highlighting what art can what art through this book does, that words cannot always reflect. So the aims really are about to help bridge gaps by adding color to chronic kidney disease, dialysis and transplantation, and using art to reflect evidence-based needs and requirements. This has been a truly collaborative effort and could not be achieved without the University of West of England Enterprise scholarship that the RPSG team had been awarded, and of course the Institute of Biomedical Sciences, or IBMS, awareness awareness or educational workshop fund, that award that the RPSG team had acquired, and this the aims really are apart from that main objective, the involvement part of this work is to is about using art and photos that have been posted on social media to connect best practices, and which is one of the key driving elements of this work, to highlight evidence surrounding nephrology, dialysis, and transplantation, to involve two leading patient professional organizations, and it is quite right to highlight that they're both professional, as well as professional and inclusive, because of the duration that both organizations have been providing and offering informational support, as well as platforms for shared decision to help inform shared decision making between the two groups. It has been close to 2 decades, not quite 2 decades yet, but it has been very close, and to involve members of both groups to help highlight these key focuses around the different themes, and to ultimately, through art, and this is what art can do, probably a little bit better, or at least a little bit smarter in some regard, that words cannot always do, and that is to prevent impoverishment, health disparities, and increase health equality, by contextualizing understanding around these different themes through photos or screen art, and by and on that note, also to highlight that all the context within this art book has been anonymized. There's no identifiable data. It's completely confidential, and that has been one of the main important points. That's one of the main focuses, and has been one of the focuses between the two international support groups, or educational informational support groups, over time, so that that the information, the understanding that comes through the groups is monitored, it is safe, secure, and that is that has been actually something that both leads the founders, admin, and the admin and moderators for these groups are very they are leading. They are examples of good practice in that regard. And just to highlight really about the three specific points on what art can do that words cannot. Again, these three main focuses, and that is to say that help art in this book anyway, inside A, that it helps identify strengths and limitations of how art posted through social media strengthen evidence-based healthcare for renal patients or patients going through the long-term condition, between pediatrics and young people and adults. Art to supplement health practice, highlighting evidence through health and disease, and of course one of the things around what art can do, quite well, perhaps versus words alone, and that is to add a bit more, color and perspective to the long-term condition, chronic kidney disease, dialysis, and transplantation, in aim to abridge those issues around potential health inequalities, or health inequity. The book has pages in there that patients and carers who have routine appointments would have routine appointments. They can document aspects of their care before going to their routine appointments, during and after, and that is something that this collaborative effort between the two organizations, and my colleagues, our research interns at Coventry University, who are doing their research intern under the Renal Patient Support Group, RPSG, and KDARS, between and of course myself, we wanted to make sure that focus is in this work, because it has been the ethos of the two organizations to ensure that through though the platforms have been used to help patients and carers help inform shared decision making, we know it is known that the understanding that before appointment, maybe when patients and carers who might go to appointments, they have they have those same concerns, but don't always either remember or feel that it might be appropriate to say certain aspects around their care at those times. So the book serves as almost can be used as a diary or a journal, and the art within the book helps can help to patients and carers to hopefully remind them around aspects according to these particular themes, and these are themes where there are still those gaps, and and not just gaps, where actually patients and carers still struggle to sometimes get answers, or clarity, if not answers, clarity around these different themes. So we're very I'm very honored to give you this breakdown, and again we appreciate the enterprise, the University of West England enterprise award to bring this work together, and the Institute of Biomedical Sciences, or IBMS, educational awareness funding that actually helped focus the underpinnings of this work through delivering workshops, which were very important bases or foundations for this work. So that's a brief on side A. I will follow up with a synopsis around side B. This work, side A, I want to finish on this, and that is to say, side A is about bringing evidence based through art and investigation, implementing best practice, and ultimately keeping renal pathological. Thank you for listening.